WHO FCTC is celebrating 20 years of tobacco control. And I'm here today with our guest, Dr. Adriana Blanco, who's the head of the Framework Convention of Tobacco Control, and Paula Jones, who is the director of ACT Health Promotion in Brazil. And we're pleased to be discussing, we just finished a panel with Dr. Tedros, the Director General of WHO, on this very important topic. Now, Adriana, I'd like to ask you, FCTC, it was implemented 20 years ago, so how did it start and why was that so important for the world, and why is it still important today?
Well, thank you, Jamie. I think that was important because it was the first time that really the public health community, and specifically WHO, using its powers under its constitution, convened the countries to have a legally binding treaty on tobacco control. But at that moment, it was a hope. It was really the idea that, okay, how can we solve this problem that is a global problem, that need to be addressed at national level, but need to be thought at the global level. So at that moment was really the inspiration, the hope. Today we know that it worked, okay? That it was based on science and it was using proven measures to control tobacco use, and now we know it worked. Because we have seen a steady decrease in the consumption of tobacco, and even for the first time we are seeing the absolute numbers of smokers decreasing, what is not easy because of course the population keep on growing. So now we have the proof. We know after 20 years of the adoption and 18 years of being into force that this work is really needed and is still as relevant as it was 20 years ago.
So what are a few of the things in the Framework Convention, this global health treaty, that really work? Can you pull out a few of the things for the audience that may not know?
Yes. The first thing is that the Framework Convention is a comprehensive approach to the problem. Before, sometime when, specifically in the area of drugs, it was much more focused given in the supply side demands, okay, trying to say no to. This is more comprehensive because it has demand side measures and supply side measures. So really, when you implemented it comprehensively, that makes a good environment for the people not to be enticed to use. And the main measures are, for example, banning smoking in all enclosed public places and workplaces, putting very prominent graphic health warnings in tobacco packaging, or even having plain packaging, that is a standardized packaging for all the products being in the same color, let's say, and bearing very big graphic warnings. Banning advertising, promotion, and sponsorship, that is a really direct conduit for youth to be enticed into tobacco control. Raising taxes, because raising taxes is the most effective individual measure to make the tobacco control less affordable and then to reduce the consumption. Providing support for people who want to quit, that is very important too. So these are some of the measures that you can have. And one more important thing, and that is very important because which is the biggest obstacles for the implementation of the treaty? The industry that profits from these tobacco products. So there is also an article in this treaty, the 5.3, that talks about how to protect the public health policies from the interference of the tobacco industry.
Absolutely, and that's so important. Thank you for highlighting some of the Framework Convention for Tobacco Control's main articles that really make it work and make it alive today. I remember when tobacco was banned in indoor spaces in the U.S. I mean, this is something that has impacted everyone in their lives in a very real way. And thank you for being here with us today. I know that you have to go. In fact, Adriana is flying out right now to go to the World No Tobacco Day celebration in Kenya, in Nairobi, Kenya, where they'll be talking about tobacco-free farms, which is Article 17, that governments should help actually find economically viable ways to help tobacco farmers switch. So thank you for being here with us today, Adriana.
Thank you.
Safe travels.
Thank you very much.
Yes.
Very good end of this meeting with Paula.
Yes. And now we're going to go to Ms. Paula Jones, who is the director of ACT Health Promotion in Brazil. And Paula, can you tell us, Brazil has reduced astronomically the number of smokers, of tobacco users overall. So how was Brazil able to reduce the smokers in their country and help people quit, do you think?
Brazil was a real leadership during the treaty negotiations. It was led by 2 Brazilian diplomats, first Celso Amorim, then Correia de Mello. And then after, and that was really important leadership within the government in Brazil. So while we were negotiating the treaty, some of the measures began to be adopted in Brazil. So Brazil was number 2 in adopting the warning labels, front of package warning labels. That was very important. We were just after Canada. So, and we had all the other policies were put in place, like smoke-free environments, including bars and restaurants, and taxation policies, which kind of is the part that we need to do a lot of work on still, because it needs to develop over time. And also like marketing restrictions. We have had marketing restrictions in Brazil since even before the treaty, because you had good leadership in Brazil. So also that kind of served as a model and inspiration for others. So you can only achieve this reduction in consumption when you adopt the entire package. It's not one or the other measure. So it's not like, okay, I'll only do smoke-free but not do marketing restrictions. It doesn't work that way.
And Brazil's now adopted all of the tobacco control
all
measures.
All of the tobacco control measures.
That's fantastic.
Yes.
So what has that done to the population? Do you have any statistics from Brazil?
Yes, we have like a reduced prevalence over 50% in the last year. So we are kind of below 10% nowadays.
That's phenomenal.
Yeah. Yes,
wow.
It is really
Congratulations.
Good. Thank you.
And you were talking about the, part of the Framework Convention for Tobacco Control is one article that talks about the tobacco industry interference that Adriana mentioned. What are some of the things that you've seen, or how do they try and interfere with policies, and how is this linked with other public health areas as well?
It's funny because being both like in the national agenda as an advocate, but also in the global agenda, you see that the Framework Convention on Tobacco Control became a bit of the holy grail for public health when you have like such a powerful economic actors that have products that make people ill. So that's one of the things. So for example, when we talk about alcohol control, people, they really would like to have a treaty of their own, that it's mandatory, that you don't have like, when you have interactions with those industries, that you have like rules for that if you are a government official. So this Article 5.3 that Adriana mentioned, which is about like managing tobacco industry interference, is a very, very important example to be used for other public health issues. Particularly when we're talking about alcohol control and the alcohol industry interference and participation in all discussions. The industry cannot participate in the decision-making process that will do everything it can to decrease consumption of that product. So it's the same logic. What the tobacco control negotiations showed us, that was a kind of insurmountable conflict of interest between the tobacco industry interest of selling more cigarettes and the public health community interest of like decreasing the sales of cigarettes. It was as simple as that. And the same is true when we think about other harmful products nowadays. Like if we think about like the obesity epidemic that we are experiencing, like the non-communicable diseases epidemic that we are experiencing because of the risk factors, it's the same logic. So we should apply we should also use the same logic from a public health perspective, because the industries, across industries, they use the same tactics.
Absolutely. And we have some questions coming in from our live audience. Fatima Imran is saying a ban on cigarettes is what is needed. It's very bad as young people, as very young age groups who are the future are so much seen engaging, ignoring their lives. A campaign and a ban completely is all that's needed around the globe. Any thoughts actually on how the tobacco industry is currently marketing to young people, just as to her comment?
Yes, I mean, of course, you have to ban marketing. You have to ensure that all environments are smoke-free, enclosed environments are smoke-free, and even other recreational spaces. You have places where you have children playing or people eating where you cannot smoke, even if it's outside. You have some jurisdictions that do that. So I think you have to have all sorts of regulation, and it's not. And I think Adriana brought it in the beginning, here in the beginning. The thing about like the Framework Convention on Tobacco Control, it's not about looking at it as a drug from the regular perspective of just banning it all, because it will not solve the problem in a way. They are talking about people that are addicted to nicotine, right? And cigarettes is a way of getting the nicotine that they need. So you need to like ensure that over time you get less and less incentives to smoke, and then you reduce it over time and you regulate that industry. I mean,
so what are some of the incentives that governments can use, that people can take to quit smoking? And at an individual level, do you know anyone who's successfully quit smoking and how they've done it?
Me?
Yes.
Yes.
You have quit smoking.
Yes.
Wow.
I was a smoker in the beginning of the negotiations of the treaty.
Oh, you're kidding.
Yes, I was.
And you were the one helping negotiate this public health treaty.
I remember the first round of negotiation, and I came here, I was a smoker, and I came representing my organization, said, oh my God, and I mean, I went through my own process. It was not easy to quit, so it brings us to the question, I mean, but it's not about the individual smoker behavior, it's the understanding of like the environment that we live in. So the environment where we live in, cannot incentivize smoking. If you're a smoker and you go to a place where everybody's smoking, it's impossible not to smoke.
Yeah.
Right? Not talking about secondhand smoke, because they're non-smokers, they will not feel like smoking. But as a smoker trying to quit, there's nothing worse than a place where everybody's smoking.
Absolutely. And I have friends who say, oh no, I only do social smoking, you know, but when you start to become addicted, nicotine is one of the most addictive substances in the world. Then that's
I can
really
talk
dangerous.
about that on my own behalf. So it brings us to another one of the measures there is in the treaty, which is the cessation treatment, right? Like you have to have cessation policy. So you have to make sure that the general public, it has to be part of the public health system, that you help smokers to quit, because it's also much cheaper for the public health system to help smokers quit than to treat them after they get ill, right? So you need to put that in place as well. It's one of the measures for those who are already smoking.
Absolutely. Now we have a lot of questions coming in. Here's one from Facebook. Edwin is asking, as smoking tobacco is extremely unhealthy, shouldn't we ban growing tobacco? So that's one of the things that you were talking about in Brazil. It's a special situation. Could you tell us more about that?
We have 130,000 families growing tobacco in Brazil today. There were more when we began the treaty negotiations. Were about 200,000 families, and we need policies to help those farmers to get away from tobacco production. It's not about banning the production, because I mean, still somebody will grow if somebody still is willing to smoke. So it's something. I think the way to go. It's not by prohibiting growing, but we can and have to promote them like with viable livelihoods, and this is possible to be done, because as I used to say, wow, individual smokers are addicted to nicotine, and tobacco growers, because we are talking about family farmer, they are in the hands of the tobacco industry, and it's very hard for them to get away from the system, because it's a system that makes them kind of slave, almost like it's similar to slavery in modern times, the way that the entire system of production, the integrated production system takes place in Brazil. So we need to help them to get out. We need to give them like technical support and to be able to grow healthy food, for example.
Absolutely. And in fact, WHO has a program that is doing exactly that, aiming to expand globally, started in Kenya, and we've just announced moving on to Zambia to support over 5,000 farmers over the next couple of years, switch from growing tobacco to high-protein beans. So helping feed people instead of the tobacco that's killing 8 million people globally. That's a really good point.
Yeah, the best, yeah, and preferably we are talking about family farming in Brazil, and there are lots of issues with the integrated production system. So it's very good that you have the policy so that you can have like agroecological produce because that's the best thing to produce in a small property, and then you have like to locally sell it. So that's the way to go.
Okay.
Yeah.
Yes, we're going to go back to Farouk from LinkedIn. In fact, is asking about the WHO Framework Convention on Tobacco Control and how it's contributed to reducing the incidence of tobacco and the impact of tobacco-related health issues. And what are the key initiatives being implemented in real time? So I just mentioned one of them from WHO, and I know there are many, many around the world. And WHO works with countries to implement the Framework Convention on Tobacco Control. How have you seen it in Brazil? We talked about reducing the incidence of smokers, but what about tobacco-related health issues? How do you think that's being supported in Brazil?
Yes, because with the reduction because of the policies that helped smokers quit smoking, and I mean the right policies, you have had a reduction in smoking, and then the health impacts from tobacco. And actually, there was there have been some papers looking at the figures and the broader NCDs in Brazil, and we have had a slight reduction because of the reduction in smoking. Whereas some of the other risk factors, you are still having like an increase in the damage of the risk factor, but tobacco has been very successful because I think one of the important points is to say, when we talk about the Framework Convention, we are mostly talking about like measures that will change the environment. So the environment makes it easier for us to make healthier choices. And if you don't regulate the industry and the way they commercialize it, the environment would always incentivize them to sell cigarettes, right? Because so that's why you have to have all these measures at the populational level, and not about like telling the individual, oh, you should quit smoking. That doesn't work. And education in schools doesn't work either. I think the tobacco control experience has showed us that you have to have the measures that change the environment, and not just like tell the individual what they need to do when you have a completely different message from the environment you live in.
Absolutely, and you're speaking with someone with experience who's quit tobacco yourself. So that's great to hear it straight from you, and now the Director of Health Promotion Act in Brazil. And we do have a question from LinkedIn. Ana Mariela Gutierrez is asking, is it a good idea to use vape as an alternative? I think the principle is the same. It's still smoking and young people are using it. Is it still smoking, young people are using it? I think I'd just like to make a comment on this question, because I know that this is something the Framework Convention for Tobacco Control is looking at, actually, at the next Conference of Parties in Panama in November.
Yeah, we have to say, I mean, what were we talking about when you talk about smoking? We're talking about like a nicotine addiction, right? So, I mean, it's still like nicotine addiction if you talk about vaping or cigarettes. And countries are dealing with that in different ways. But I mean, if we want people to get free from this highly addictive product, it's not a good option to choose.
Absolutely, and WHO says the same thing. Where e-cigarettes are not banned, they should be highly regulated.
Exactly.
Because we have seen the data show that it actually can act as a gateway because of the high prevalence in nicotine in many of them, that people often start smoking. Sometimes as high as 50% of e-cigarette users become smokers later in life.
Yeah, and the thing is, what we are worried about, it's like youth, right? And it is much more appealing to youth than regular cigarettes. I mean, it's more modern, it looks like a pen drive or whatever, it's fancy and this and that, and that's the part of the appeal. So, I mean, what we need, I think it's very wise to use the precautionary principle. I mean, because if like cigarettes came out in the market today, I don't know, I mean, how many years took it for us to regulate it the way we were able to regulate today, and we still have a long way to go.
Absolutely, and we know that it harms brain development for young people under 25. It actually has impacts on your heart as well. So there's a lot that we don't know, which is the scary part.
Yeah, it is an addiction still, right? So.
Absolutely, and on the panel earlier, Dr. Tedros said about the tobacco industry, you have to think what kind of people are marketing something addictive and dangerous to young people.
Yeah.
So this is
and we have a lot of addictive products out there, right?
Yes, absolutely. Okay, we have another question. I have participated in trying to quit smoking in my role managing the care of patients with asthma and chronic obstructive pulmonary disease, but more health promotion is required. How does WHO actively support countries worldwide in this? I can actually answer this one as WHO. I know one thing that we do is support countries in cessation programs. We have, for example, one program in Jordan that is providing counseling as well as nicotine replacement therapies. When those goes hand in hand, we know that it can help people quit. Thank you for asking that question. The problem of chewing tobacco is a major problem in certain countries, says Sonhanit Halder. What about chewing tobacco? What do you have to say about that?
I think it's the same principle. We're still talking about an additive product that has like a harmful impact to health, right?
Absolutely. Yes, it falls under the whole portfolio of tobacco products. Yeah. We're going to take one or two more questions before we wrap up. We have quite a few to choose from. Let's see. Regina from, that was Regina from LinkedIn. The nicotine industry is being creative in presenting vaping and other forms of smoking as less harmful or non-harmful. We must be careful providing the accurate info. Absolutely. I would say this is part of the tobacco industry
It's something
tactics.
that we still learn a lot about, right? What's the impact of vaping? And there's some really bad things coming out there. So I think we should be careful.
Like you said, in 1955, we were talking about on the panel earlier that the link was made to cancer as early as 1955.
Yeah, and it took us so many years. And remember the story of the light cigarettes.
Yeah.
I mean, that was, and it happens all over the place. Okay, you start talking about cigarettes. Okay, instead of quit smoking because they have to sell the products, just switch to a light one. It's a new version of the light. It's the same thing with sugar. Now all the conversations about taxing sugar and so on, what is the soda industry doing? Oh, switch to light soda. It's the same as light cigarettes. I mean, this principle of like reformulating unhealthy products to make the consumers still consume it. That's what they're talking about.
Yes, absolutely. We have a great question from Bikesh from LinkedIn. And Bikesh, I'm really glad that you asked this because he says, FCTC, the Framework Convention on Tobacco Control, was adopted in 23. Despite this, we haven't seen a decrease in tobacco deaths. But actually, we have seen a tobacco decrease. And now 5.6 billion people are protected by at least one tobacco control measures, things that you mentioned. So graphic warning labels. You see, what do some of these labels have on them in Brazil?
Oh, they have all sorts of like tobacco-related diseases. I mean, from lung cancer to getting amputated. So there are lots of like different warnings.
Yes, the very scary health situations that happen if you're a smoker or tobacco user. So I think these graphic warnings, things like this, really do make a difference when people see that.
Absolutely, absolutely. Because I mean, the cigarette pack, it's also a way of advertising, right? The product. So you take away the glamour of the packaging, which packaging it's also a form of advertising. So it's a way of taking out the glamour and creating a more like, and it's actually very also important, for example, in countries where you have like a larger number of illiterate people. So it plays a role there. And I've heard the individual testimonies about that in Brazil, of people that were illiterate. Wow, when I saw those images, they're like, I had to quit smoking after I saw the pictures. So.
I mean, it impacts, using tobacco, it impacts every part of your body.
It does.
And I remember even I learned recently that it impacts your eyesight. You can lose your eyesight 5 years earlier when you're older. So these are really scary things. And I just wanted to thank everybody for joining us here today, especially my guest, Paula Jones from ACT Health Promotion. She's the director of ACT Health Promotion Alliance in Brazil. Thank you for joining us and the panel with the Director General earlier. We're coming to you live from the World Health Assembly in Geneva, Switzerland. And we're joined today by hundreds of countries, in fact. I'll just name a few of those that have joined us: Barbados, the U.S., Brazil, Saudi Arabia, India, South Sudan, Pakistan, Indonesia, Afghanistan, Botswana, Cuba, Bangladesh, so many of you for joining us online. Thank you. Please continue to leave your questions, comments. We'll be following up. And don't forget that this Wednesday, the 31st of May, is World No Tobacco Day. And this year we're talking about the need to grow food, not tobacco, to help feed millions of people across the world, rather than tobacco, which kills 8 million people every year, 1 million of them from secondhand smoke. Thank you so much for joining us today. And thank you, Paula.
Thank you.
It's really a pleasure to have you. And so nice to finally meet you.